Hello and welcome to Moving Along. We have Professor Elena Moro here today to teach us about brain health. Professor Moro is located in Grenoble, France, and she has had an amazing history of working in movement disorders, a real inspiration to many women. Working in movement disorders has been a mentor to me, and she is also the president of the European Academy of Neurology. Welcome, Elena, today.
Thank you, Indio. Thank you very much for this very kind, and I was looking forward to this invitation.
So we're so excited to highlight brain health, which is something that I think you and I both care a lot about. We've spent time at the American Academy of Neurology together, listening to their sessions. But I think the EAN, in my opinion, is a real world leader in this space. Maybe we could start by teaching our viewers about what defines brain health and why should we care?
Well, we don't demand to teach people about the brain health. We just want to make aware, right? The neurologists and especially the movement disorders neurologists, because I think this no the main focus of this interview about this concept that is relatively new and especially for neurologists, what is this complex uh, concept? And indeed, I think is still a bit complex because we are using the definition that the WHO has put available in their website. And when you read it, when you go through, it looks a bit complex, but I can repeat, but then what I would retain. So basically, brain health should be a state of brain functioning across cognitive, sensory, social, emotional, behavior, and motor domains, which allows a person to realize their full potential over the life course, irrespective of the presence or absence of disorder. So we understand this is sort of when we are good with ourselves, with our brain in any time of our life, and even if we have a disorder, a disease, which is, it makes the concept a bit tricky, I would say, but finally, I think we can see that the idea is really to protect the brain and to preserve the brain as much as we can to allow a full function. But we are working in trying to make this definition a little easier, right, to everybody, which is not simple, but this is one of the next activities of the European Academy of Neurology.
Yes, I think even defining brain health has been a little elusive for all of these organizations, but it is an exciting time.
Mm.
I know that the eye gap had just been
Yes.
described in 2023, I believe, and it includes Parkinson's disease and many other neurologic disorders now. Can you tell me what that is? What is the eye gap and also why that matters?
IGAP is the Intersectorial Global Action Plan that the WHO launched a few years ago. Initially was only for epilepsy, but then we asked, the community asked the WHO to address this plan to all neurological disorders. And the plan is basically is global 360 view or how to prevent, to treat, to diagnose, to treat, to manage, to improve neurological disorder in general in the countries, in each different countries. So and they're asking the governments to implement this strategy in their public health plan, in their teach research plans, in their Ministry of Health, in their Ministry of Teaching and Science. So it's really a very detailed plan that they recommend each state to implement for all neurological disorders.
Yeah, I think it's a very exciting time to actually have the WHO talking to different countries. And I know throughout Africa, they're finally having, each country sign up for this.
There
So
is a toolkit that has been developed to make it simpler and have some action because it's very detailed. It's in the WHO website. It's very detailed, and there's some this toolkit which can help. I think we wrote also a case to make it no much more easier to understand and to apply.
That's really cool. So obviously, we're at a time also we're caring about the brain, we're emphasizing prevention and thinking about how to protect the brain, but we're at a time when, we have limited resources globally. I know that the EAN has identified some public health strategies that they've proposed, including I believe, some school outreach, school challenge, some leadership programs, some research projects, and advocacy training. Could you teach us a little bit about each of these?
Yeah, because into the problem, I think, as a neurologist and also as a movement disorder specialist, we have to focalize on the fact that 40% of the population in the world is living or will live with a neurological disorder, which is a dramatic thing because 40% with a shortage of neurologists, a shortage of movement disorder specialists, and we know that Parkinson's disease is increasing. But in the same time, just to give you an example, and it's been recently published, 90% of the stroke are preventable. 90%. And we know now that dementia, 40% is preventable. What's about Parkinson's disease, right? What about the other neurological movement disorder that we are treating? So this is the reason why our campaign is based in making understandable this concept of brain health, which is prevention, but not only prevention. We said also optimizing, right, the management of our people living with the neurological disorder. So it's awareness of this. Then we are teaching neurologists to advocate in their country with the Ministry of Health, with the policymaker, making them aware of this dramatic situation that we are facing. And then also is to help the healthcare professional to manage to be much more knowledgeable and helping people with that. And in this context, during our EAN National Annual Congress, we organize several things. So we have a Brain Health Public Day. So together with the Congress for Neurologists, we opened the door to the local population. We were in Helsinki, so people living in Helsinki and the surrounding Finland, they were coming, and we were talking about epilepsy, migraine, stroke, prevention, management with the neurologists and patients. And also, as you were mentioned, we have created a brain health advocacy school. Is a one-year program in which we teach mainly neurologists from Europe, but also outside Europe, to become the ambassador of brain health in their country, right? And we have launched the Brain Health Mission, which can be found in our website, which is a call to other European society, but also the international society, so to join us in this strategy that I was mentioning before, and that we publish. We publish a roadmap to give everybody the possibility to understand, but also to benefit from this brain health campaign.
That's amazing. And are you also doing something in the schools as well?
So the Brain Health School Challenge. This is the classical example that we give, right? When we are kids, they teach us to clean our teeth, right? So how you have to clean your teeth to protect, to prevent caries, right? So the idea is to do the same, to teach kids to protect their brain. And so we use models, we use the police for the brain, the way that they understand the basic concept, and they start acting and sleeping, healthy diet, exercise, wearing the helmet, just and they learn, they write projects, and we have developed a kit, and we are doing in several European countries this special, and there is a prize day in the schools where we go in the school and we do that.
How cute. That's amazing. We need to do something like that here too. And
But there is, I think, the American country, they have the hop hop, something similar, right? So, which is one other program. But I think, everybody, we are very happy if, everybody can join and have other new ideas to develop this concept, from the beginning of our life.
yeah, yeah, that sounds amazing. The advocacy training that's a year, can some of our members apply to do that? How do you get selected for that?
So there is a huge competition because we have 60 position available, and last year we have 360 people applying. So basically, we recommend the National Society to send a person from their National Society because they can be ambassador with the Minister of Health, with the stakeholders in their country. This is we don't have today the capacity not to teach and because it's quite a dense program within 1 year, more than 60 people today.
That's amazing.
Yeah, yeah,
It's
yeah.
really, so it's online and you have a
It's
curriculum.
online and they meet also the projects. Professor Bassetti, Claudio Bassetti, also in Switzerland, organize a three-year a master in brain health as well.
Wow.
Yes, it's a bit expensive, I have to say, but is I think it's 2-year program in which really you can get much more deeper. That is, a master is completely different, but it can also. I don't remember how many, maybe probably there's a website is in the Bern University and is a bit more consistent and as a master, of course. R is 1 year program. It's a bit different.
So it sounds like you're really advocating also about these lifestyle choices. So things like sleep, exercise, diet, social engagement, and that's is very exciting. I think it's a really new sort of page in the book. As neurologists, we're just used to reacting after somebody's been diagnosed.
If we look at our colleagues, the cardiologists, actually they've been doing for years,
Yeah.
right? For the heart, the same exercise, healthy diet, a Mediterranean diet. They don't talk too much about the sleep, and I think this is our, it concerns the brain. But also, I think we are adding, as a neurologist, taking care of the brain, this social aspect, cognitive aspect, these determinants of brain health that are peculiar to the brain. So I think we need a little more research to understand what makes the difference between, the same suggestion that the cardiologist gives to his or her patients and what we give to our patients is not the same. They are basically some, of course, we know the interaction between heart and the brain, right? And especially now with the hypertension and all the vascular diseases. But I think we want to concentrate on the brain, the determinants for brain health, which should be a bit different compared to the cardiologist advice.
hmm hmm We have the wellness task force at the MDS, and we've been trying to put together some of the evidence base, at least in Parkinson's. So I think we hopefully will have a publication to share quite
Absolutely.
soon. So we're excited about that.
Emotion, stress management. Well, now we know, you know very well all the problem with the pollution, climate changes, which they are having a big impact on several disorder. And I think now we are recognizing more and more the impact in neurological and psychiatric disorder, right?
Mhm.
So it's a new as you said, it's completely new chapter that we need to master,
Yeah.
right, as neurologists.
Yes, and I think loneliness is something, especially in the pandemic, that we've had so much
Absolutely.
of, right? So, and think keeping people socially engaged and in their communities is also pretty key.
The
Um,
beginning.
so you have a number of resources, it sounds like, on your website, so people can go there and look at
Yes.
the EAN
Yes.
website. And then, how do you envision? I know you said that you've had asked a number of other organizations to partner.
Yes.
What do you envision as the MDS, the movement, the International Movement Disorder Society, being able to partner?
The MDS is a partner of our
Oh,
brain
okay.
health mission. Yes, yes, the president usually is invited. I think that now that we have a plan, right, how to expand, the collaboration with the MDS is really to find together, I think, and I think MDS, of course, can do everything by itself, but globally to join forces, for example, for maybe a special roadmap for movement disorder for the patients, right? How we can get our patients more engaged, right, in trying to prevent it, to optimize their brain health at home with the caregivers. And I think this should be a little more emphasized, right? And to find, to optimize, right, according to where you live, right? If you don't have a physiotherapist, how you do that? To really to adapt and to give a solution to our colleagues and to the patients where they are, and to have a research projects to apply, not to be a little more open and to this aspect that they look less scientific, but I think that they are really scientific as well,
Yeah.
right?
No, I
And
think we're a long time coming to think about the whole person, the holistic kind of aspects that you mentioned.
the European Commission has put 400 millions for the Brain Health Partnership with grants that they will start. There was a grant call for brain health at the beginning of the summer, and next year there will be a lot of other call for research application concerning brain health. So
That's so
this is
exciting.
the European level and the horizon for stressing the importance of research, right? And now we have also the digital health, artificial intelligence. I think it can be an opportunity to use.
Wow, what an exciting time we're in. Well, thank you so much, Professor Morrow, for your leadership
Thank you.
and for taking the EAN and incorporating this as such a valuable thing. And I think, the rest of the societies are sort of also following along. But hopefully we can partner across the world to really change brain health for all of us.
We are ready.